Hi, What the Health Tech listeners. I'm your host this week, Daniel Grant. I'm Partnerships Manager at Radar Healthcare. This is the podcast where we tackle some of the trending topics, ideas, and best practice in health and social care. In today's episode, I'm excited to be joined by Emma Miles, Care Consultant at Cura Healthcare Solutions. Emma brings a wealth of experience, having worked as a nurse and held leadership roles in care organisations like Avery Healthcare and Macc. Today we'll be diving into the vital role that data and technology play in improving care outcomes. We'll discuss how to simplify the use of technology within your organisation, providing teams with easy, trackable oversight, and how this ultimately leads to better outcomes for the people you support. Welcome to the podcast, Emma.
Hi, thank you, Dan. Thank you.
It's lovely to have you here. So, Emma, could you start by telling us a little bit more about your background? Because you've had quite a varied career.
Yeah, absolutely. So, I became a registered general nurse 27 years ago now, and worked in the NHS initially before moving out into the elderly care sector, where I got my first home manager position in 2003. And throughout that sort of 15-year period, I was a home manager in several care homes, as you mentioned, for Avery Healthcare, for Bupa, and before working my way into those more senior roles. So I joined the operations team as a regional manager for Avery, and then moved over to the quality team as Associate Director of Quality with Avery. And then I joined Macc as their Quality Director. And then September last year, I actually made that leap to go out on my own, and I started my own quality consultancy across the care sector. And it's been a really busy time since then.
That must have been quite a scary leap to make, but it seems like it's been going well so far.
Yes, absolutely. And just that ability to go and support and coach care home teams and help with systems. The variety. It's really it's everything I wanted it to be.
Yeah, are you finding that you'll be able to pick up best practice in all sorts of different organisations more quickly than you could staying put in one place?
Yes. Not only talking to staff and getting their input and their ideas, but actually being able to share that good practice as well. So definitely a two-way system.
Fantastic. And how have these experiences shaped your perspective on using technology in care organisations?
Yeah, I think, when technology first came into the care sector, a long time ago, I think at that time, many of the systems, it felt very much that we were having to fit the system rather than the system, helping us. I can remember one system I used when I was a home manager, where it was putting residents' details for a move-in or a possible move-in into the system, and it was a very time-consuming piece, but great that we were capturing all of that information. But it was then very frustrating that I had to keep going back into the system and tweaking it just so it actually captured the clinical picture that I could see as a clinician. And, or the technology would do part of the job that we wanted it to do. So, great for capturing information, but then it was a very long-winded manual process still to then actually extract that data. And I think, as time has gone on, as I've worked with, yourselves at Radar, can really see now that having that clinical input into the technology means then that it's a more usable system out on the floor, and it's actually given us that information that we need to help drive outcomes. There's no point gathering the data if you then can't analyze it and do some good with it. So I've definitely seen, across the years that shift within sort of technology, and the oversight that it gives us now, whether that's at home level or regional level or company level, to have that oversight of things like incident and accident reporting, auditing, things that were very paper driven. And actually, if I would have wanted to do that analysis piece and that trending piece, it would have either been scanning paper documents or actually physically going to homes And again, that very manual process of looking for those trends. So yeah, the technology that we have in the homes now, we said it works with us. So
That's great. So yeah, it sounds like you're describing a shift from moving ownership and ownership and input into these IT processes away from strictly IT teams into the people who are the direct stakeholders, like the quality and clinical teams. Is that right?
yeah, absolutely. We've all sat in meetings where somebody comes up with a great idea, but actually then that idea out in practice, you need that feedback to say, well, actually that's not going to work. However, or maybe we could change it this way. I think it has to be that two-way, and definitely having that clinical input, whether you're a care provider or an NHS service. Like I said, you have to have that input and feedback from the staff that are using it on the floor.
Yeah. That was my next question, really. To say, do you think that's helped then to ensure their voices at the front line of care are heard by keeping it within the clinical and quality teams?
Yes, absolutely. We have a range of ages, within the sort of the workforce, and sometimes people can be afraid of technology. So I think, getting that feedback of keeping it simple, breaking down the tasks, it really, it just helps embed the system into practice. There would be nothing worse than having an amazing system, all singing, all dancing, but actually staff don't feel confident to use it, because then that's just counterproductive of what we want to achieve.
Of course. And what advice would you give to other organisations who might be feeling apprehensive about the way new technology might be received by that front line of staff?
Yeah, I think it's about having that input. So with the radar system, creating the events, creating the audits, really think about the processes that you currently have, and also what do you capture now? What do you need to capture for external stakeholders? And so how can you make the system fit what you need it to do, but also think about what would you like this, what data or what information would you like to capture that you can't currently, and really think about how you're going to introduce that system into the team. So from that development side, like I said, keeping it simple, breaking down tasks, adding in prompts into the system, adding information into the system, really helps then to have those champions. So, if you're going to trial any technology, having a sort of a smaller team that can really then has that feedback, but can then be those champions, so that when you roll it out to the larger organisation, or sort of further homes, further services, that you've got those champions really that have been with you from day one, and they've had that input, they've been able to give that feedback, they've really been able to test it in their home, and then training. So when I've rolled the system, technology systems out before, not only have we done the face-to-face training and the Teams training, but we've then had a drop-in session as well that's just in the diary weekly, so that people don't have to come on, but if there's been an issue, or if they just want to come and listen to what some of the other homes, their issues have been, just having that accessibility really, to be able to ask questions and not shy away from using the system.
Brilliant. Thanks, Emma. Yeah, I completely agree. I think one of the most powerful messages I've seen is when we've been doing stakeholder engagement with a technology rollout, is organisations sharing that they were listing not only what they wanted their staff to be able to do and to be able to know, but also how they'd like them to feel about the implementation and to feel about the new technology. So
Yes.
It's really good to hear that side of it as well.
Absolutely. And, when we have had feedback from staff teams, like I said, putting the prompts in there, actually it's really empowered the staff. That's been their feedback, that the system has empowered them, because before, where they weren't maybe sure, right, have I ticked all the boxes? Have I completed everything that I need to do? Actually having those prompts in there, they really felt confident that, no, actually, I'm happy that I've seen, whether it's, reporting an accident or reporting a skin concern, I've completed everything that I need to. Therefore, I don't need to go and ask. And feedback from managers was actually the amount of on-call conversations that they received lessened, which that hadn't been our intention. But actually, where staff would have called them out of hours to say, I'm just checking, have I done everything? That actually reduced because the staff felt confident that they had. So that was, something that we hadn't thought about, but another great outcome.
Yeah, a fantastic result, and I can imagine that confidence and that empowerment also might contribute to culture and retention and longer careers within healthcare. So that's brilliant. Fantastic. So obviously you and I have worked together for a while, and I think the last time we met was at the Care Show in Birmingham, which is a fantastic event. If any of the listeners that haven't been but are thinking about going, really interesting. Some fantastic speakers, including Emma yourself, last year. And last time you were speaking with us on stage about what sets Radar Healthcare's approach to data management and reporting apart in terms of supporting care teams in real time. Could you tell us a little bit more about your experience of that, in particular around the reporting and the data analysis side?
Absolutely. So I think for me and the teams, the fact that Radar is that one-stop shop, particularly around incident management, maybe potential safeguarding concerns, actually the system allows, that incident or that event to be followed right from day one of it occurring right through to that sort of resolution. And the feedback from the managers was that, it's live, it's being captured live in the moment by the staff team out on the floor. You've then able to attach, your investigations, your supporting documents, and that follow through, who was contacted, when were they contacted, all parts of the process. And that feedback from managers was that actually then if there was a safeguarding concern that was taken further, or, if there was an accident that then needed that investigation and duty of candour and, all of that sort of regulation information that we need to give, they again felt confident that everything was all in one place. Prior to that on paper, you might have your safeguarding log, or you'd have your complaints log, you'd have your accident forms, you'd have your investigation templates. So, all of these documents sort of scattered, across a number of files. And sometimes events might not, a resolution might not happen for a period of time. So again, it's making sure that all of that information, so they really loved the fact that for Radar, it was all in one place. Like I said, it really gave them that confidence that, they can put their hands on everything that they needed to very quickly. And with it being electronic as well, more and more correspondence now is being sent via email. So very quickly they could pull all of that information together. So definitely that one-stop shop approach. And then, the analytics. So like I said, technology in the past, it great for gathering the data, but actually it was a manual extraction. I can remember being asked to look at skin concerns and the location of the body that they were. So, at that point, I was working for Avery, sort of 65 homes, and I would be there with my pen and paper and my little tally chart, just, like one left heel, one right heel, and it was a very long-winded process. But from a quality perspective, what we wanted to achieve, well, let's look at, are there locations of the body where we're getting more skin concerns so that we can drive, maybe we need further training in an area, maybe we need to get information out to staff, regarding these types of skin concerns. So when we came to take on Radar, we initially had the analytics that comes, the live event analytics that comes with the system. And at that point, it wasn't given us that detail. It was given us how many skin concerns we'd had or how many accidents we'd had. And when we found the radar bespoke analytics, that was a real exciting moment, because we felt as a team there was just that piece missing. We knew that we were capturing the right data, not only the reactive data, but just starting to look at that preventative data as well. And we just knew that, like I said, we were capturing it, but we weren't quite seeing that level of detail that we wanted to. We worked with yourselves to create our bespoke dashboards. And, I met with several companies that had already used them, and they'd very much got IT teams that were going to create these dashboards for them. And at that point, we didn't have that. I was leading on the project. I'm a nurse, my team were nurses, and working very closely with Mark Fuster, because there was sweat and tears went into creating these bespoke dashboards. We kept saying, but we're just nurses. We're not, yes, we can use IT, but we're not that sort of IT savvy. But the Radar team really, really helped us to build those dashboards. And I think at the end of that, we were really pleased with what we'd created. And like I said, they weren't all singing or dancing dashboards that we'd seen in the examples and like I said, that other companies had been able to put together. But actually for us as clinicians, we knew what data we needed to collect internally and for our external stakeholders. We knew what data we wanted to be able to collect that we weren't currently. And again, we wanted it to be really simple to use at home level and very visual, because, the managers are analysing this data every month. So we wanted to keep it simple. And like I said, we were really pleased with what we created. We sort of created 5 or 6 different dashboards. And when we shared those with our home managers, you could just see they were super excited. And then just like us, were like, this was that missing piece. We knew we were putting the data in, and now I can see it. And again, because those dashboards are so visual, before we were extracting data into an Excel spreadsheet where if you're looking at times of a day, days of a week, it's just data, isn't it, on a sheet. But the bespoke dashboards really brought that alive, to do that analysis piece, and then for the managers to drive those outcomes and to be evidencing, to CQC and any other stakeholders, what are we doing with this data?
Fantastic, yeah, and I'm sure it must be reassuring for them to know that they're following an evidence-led approach, and they've got that clear mandate that the data is giving them to take action. Yes, absolutely. Because I said there's no point gathering that data if we don't do anything with it. Yeah. So I think something that we hear quite often is people have got the will, they want to get the bespoke dashboard set up, but not always sure what they'd like to surface, how they're going to best serve the various audiences in their organisation and what data they should be focusing on a dashboard. So what was your process? How did you go about identifying what are the key metrics you wanted to be measuring?
Yeah, so sitting down initially, we had other systems that we would put data, some monthly metrics that we would collect as a company. So we started off with, right, what are we currently needing to gather for us as our internal process? Lots of counties have to, give reports to their local health authority. So again, what are we being asked through from them? It might be that on our CQC PIRs, we're asked for data. So really looking at what are we currently asked for? And then, like I said, some of those, what are those processes that we would, at the moment, are a manual process. So like the example of the body locations of the skin concerns. And what other data would we like to capture that we aren't currently? So one example was we had in one of the companies that I was supporting, we had the dechoker devices within the homes. And the training manager had been to a home and sort of said, and you've got this piece of equipment in your home, the dechoker, and staff said, oh no, it had to be used a couple of weeks ago, so it's not been replaced. So at that point, we were very quickly able to respond to that and put that into our event, so into our choking event, that said, was the dechoker used in this event? And if they clicked yes, then that would send a message to our training manager, or we could put that onto our bespoke dashboard, so that then she knew to order a new dechoker. So it's looking at, what are some of those frustrations that are currently, at home level, company level, that you can actually use the dashboards to highlight some of those issues so that they can be resolved quicker. So all of us, all departments, all came together to gather that information. And then it was a case of, how best to present that data. So, we agreed that some data we just wanted the number. But other data, we wanted to see it in bar charts. We wanted to see if, that sort of trending piece over months, over the years, again, to be able to benchmark where we are in time from, this February to last February. So we really thought about and captured that sort of on flip charts, really building up those dashboards, that sort of manual process to then sit with the system and bring it to life.
Fantastic, brilliant examples. Thanks, Emma. And so looking ahead, how do you see technology evolving in the care sector? What innovations have you heard about that you'd be excited about, or anything that you think you'd like to see but you're not sure is out there yet?
Yeah, so like I said, technology has been coming into the care sector and a very sort of quick pace these last few years. I think we are still seeing gaps in integration, so I know lots of systems are now starting to integrate. But I think I'm sure, lots of people would agree that actually that triangulation process for us as managers, as care homes, because there is still some duplication, so staff are having to input information onto one system and then onto another system, and the homes are busy, their staff are busy, and there is that danger that one system becomes updated but another system doesn't. And if you're thinking about resident safety, like I said, and compliance, I think the more integration that we can see, so that you're confident that you've put it onto one system, that it's going to pull through into those systems that you use. I really think that, and like I said, I know it is happening more and more with the integrations, but I think once we've got a fully sort of integration between systems within a care home, I think that will then give us far more reassurance that we're not missing something. As you can imagine, if there was a resident's modified diet was changed, from a salt visit one day, that if that's captured on one system but not captured on another system, there is that danger then that something can be missed. So just more integration, and that would be the ideal world.
Brilliant, yeah, and I think that's something that we have a lot of our partners passionate about, and it's something that we're looking at in the future as well. Is more and more which organisations are we hearing that our partners want us to integrate to, and being able to open up those conversations, but being led by yourselves, by our partners who are telling us where they see the data coming from in order to make the best informed decisions and minimise that risk, as you say.
Yeah, absolutely.
Perfect. Thanks, Emma. So that's been lovely. It's been really good to hear about your experience in the implementation side and in crafting those analytics to be able to allow you to make informed decisions. So at the end of these podcasts, we always like to ask the question, what is your what the health tech moment? So what was your whether that's a light bulb moment, whether that's something interesting that's happened to you. But what was your What the Health Tech moment that you'd like to share with us today?
Yeah, thank you, Dan. Yeah, so this was the one question that, I sort of really thought hard on it and wanted to, share a good moment. So it is radar related. And it was, a couple of years ago when I was working for Avery, we had our company conference, and I was asked to, along with a colleague, to do a presentation on the CQC, the new ways of working with, and what those changes meant for us as a company, but for us as the whole health and social care sector. And because we were working with Radar at the time, we invited our Radar success manager along, and he was actually sitting in the conference when I was, giving my presentation, and we were talking about the new evidence categories for CQC. And as we know, it was capturing feedback from our residents and their loved ones about their experience in the home, and capturing feedback from health professionals and external stakeholders that visit homes, and also staff workforce feedback. So I'd given the presentation, came off the stage without falling down the stairs, which is always a bonus. And actually it was Mark, our success manager at the time, just came over to me in the coffee break and said, "Do you know what you were just saying about CQC and the evidence categories then, we could do something, we could work something on Radar." And I think at that point, we were seeing Radar as, that compliance, but from an accident, incident, complaint, sort of what's gone wrong. And actually hadn't thought about using the system about, capturing what we do right, but also capturing that feedback as to what we could do better. So the conference was over, and very quickly I had a Teams call just to sort of talk through how we could do it, and met with our activities sort of director at the time, and we sat down and we just wrote our feedback events. So, what are the questions that we would ask our health professionals? What are the questions we would ask our residents and their loved ones and friends that are coming into the home? And very quickly we created these events. So a resident feedback event and a relative and visitor feedback event. I would say within 2 weeks, we were able to pull everything together. We created our QR code posters for our reception areas, for our resident spaces. We incorporated the resident feedback into our resident of the day that we were completing at the time, and also created a bespoke dashboard for showing off the feedback that we'd gathered. So I think it was that light bulb moment at that time for me was, like I said, we'd seen the system as capturing those risks and of course all the things that we need to monitor, but actually we could use the system for other areas, and having the dashboards, reading the feedback in the first place, and then having the dashboards that we could share on our, you said we did boards in our reception areas, sharing them with CQC inspectors, local authority visits. It was just to see how responsive we could be. So if there was a change, that actually we could very quickly create an event, get that message out there, and then, start evidencing that data. And from there as well, we then went on to what else could we use Radar for? And the next thing we chose was our company award nominations. So on a manual process of getting those nominations in, I think the year before we'd had sort of close to 20 nominations. We added it to Radar so that all staff groups could go on and nominate individuals. And we were inundated. We had sort of, I think about 430 nominations. So huge. So I think, like I said, that light bulb moment of what else could we use the system for? And I'm sure there's lots more ideas out there as well.
That's fantastic. I love that answer, Emma. Thank you. I mean, for me as well, I'd completely agree. That has been my favourite social care and healthcare trend of last year, is that cultural shift towards On one hand, giving a voice in terms of feedback, giving a voice to friends and family and residents, people we care for, but also the opportunities for learning from excellence, or however you want to call it, but learning from excellence in any guise. The opportunity to do that through a digital solution, and being able to replicate and amplify that excellence within an organisation and cross-organisation has been really fantastic to see. So thanks, Emma.
Thank you. And just celebrating that excellence with the team as well, isn't it? We always focus on what haven't we done yet? What is there still to do? We focus on the negatives, but actually let's celebrate the positives as well.
Absolutely. Thanks so much for joining us, Emma, and thanks to all of you for listening. Join us next time for another episode, and please don't forget to rate and subscribe. And if you've got any other questions for us or for our guests, please email whatthehealthtech@radarhealthcare.com.